Recording.
What?
Good afternoon, everyone. On behalf of NEHA, welcome. We're getting our speakers situated. So we're glad to have you all here. While we're waiting for our speakers, I'll give you a little bit of a promo for our upcoming AEC, our Annual Education Conference and Exhibition, which in 2025 will be in July the 14th through the 17th. We're going to be in beautiful Phoenix, Arizona. So excited about that. We're preparing for a lot of sessions for you, including a few in advocacy. So we think that that's going to be incredibly helpful to all of you. And so, like I said, we are getting our speakers ready to go. I see that we have a few of our members here as well. And we also have with us, luckily, Dr. David Dyjack. He is the CEO of the National Environmental Health Association. He has been with us since 2015, if I'm not mistaken, Dr. D.
It's true. It's good to see you, Michelle.
Good to see you. And that we're gonna kind of move ahead just a little bit here. And you know, as we're doing this, we've been doing a few of the advocacy insights with Doug Farquhar, who is our government affairs director, who should be with us shortly. But we do this because environmental health is primarily local. This is meaning that the state, city, county, and tribal governments provide the majority of environmental health services and that the public receives. You know, that's what we all do, right? Food safety, restaurant inspections, indoor environments, vector control, recreational waters. This all sounds familiar to us because it's part of our day-to-day environmental health services that are performed by you. So the state legislators, county commissioners, and city and tribal councils who authorize and fund environmental health programs are for the most part unfamiliar with everything it is that we do. Most policymakers rely on their public health leadership to advocate and advance environmental health services on behalf of the communities that they serve. And here at NEHA, we work to provide information and data to be able to assist in promoting environmental health and the services it offers. So we're here today for this webinar to discuss the upcoming changes in Washington, D.C. and how that will resonate in the states and the state agencies. As I said, Dr. David Dyjack has been our CEO since 2015. He's well-versed in a variety of environmental health aspects on the local, state, national, and international realm. He's also had some experience with the advocacy and a lot of the workings of the federal government agencies that we work with in order to do our environmental health work. So, Dr. D, I'll just go ahead and start with you. Are you able to give us an overview of the key changes that we're able to expect here in Washington, D.C. with this upcoming 119th Congress? This is the Trump administration. How do you foresee these changes are going to impact state-level environmental health programs and agencies?
Wow. So why don't you start with an easy question, Michelle? Like everybody else in the country who is employed in public health, we're trying to read the tea leaves and understand what will be the priorities of the incoming administration. To some great extent, I know what everybody else knows from what we read in the newspapers. There seems to be, at this moment in time, a major interest in chronic disease, lifestyle disease, in nutrition, and specific attention to some traditional interventions like vaccines that have historically worked very effectively in the United States, but perhaps will come back under reconsideration with the new administration. At the federal level, it's not clear what the priorities will be for environmental health. But as you know, Michelle, about 85% of the work that's done at the local level and environmental health, Michelle, is profoundly local, as you know. And I heard reiteration of that today in a phone call I had with federal officials. Most 85% of the support for our local work is generated locally. And so for some elements and dimensions of public health, like epidemiology, it is not all, but a lot of epidemiological support in the United States originates with the federal government. That is untrue for environmental health. Most of the environmental health practice at the local level is supported locally. So what does the new administration mean? It's unclear, but because of the way our profession is constructed and supported, there may not be major effects to staffing and the like, at least right away. What is of concern to me, and I hope I'm not talking for too long here, what is of concern to me is the impacts on the thought leaders in the country. For example, a lot of the intellectual development and considerations around practice originate at the U.S. Centers for Disease Control, the National Center for Environmental Health, the Agency for Toxic Substances Disease Registry. And those best practices that come out of those agencies could be affected depending on the priorities of the incoming administration. That's what really concerns me. CDC is the glue and the catalyst around a lot of new and emerging practices in environmental health, and we just don't know what the new administration's priorities will be. If it is to defund, in large measure, CDC, and this is what we're hearing, then that could be troubling for the profession writ large, because the exchange of intelligence, the exchange of best practice, and new and emerging kinds of technologies which originate with the federal government could be impacted by a change in philosophy. This is yet to be seen. I'm optimistic that we're going to get to a better place, that the profession has always rallied around itself, and we will continue to do that no matter what decisions are made in Washington, D.C. That was long-winded. I apologize for that, but I hope you see this is a bifurcation in the road. Practice is largely funded and supported locally, but the new and emerging technologies and practices come largely from the U.S. Centers for Disease Control, and we don't know what type of support our major partners at CDC, what they will look like going forward.
Dr. Dyjack, can you hear me?
Yes, are you in a spaceship?
I am at even better than that. I went to your favorite restaurant in the world, In-N-Out Burger. So we are here, but we have a lot of great things to talk about with government affairs.
Doug, would you like me to start your slide deck?
Please. And if you could go to the second slide.
I will do that. Everybody can see the slides well? Dr. D?
Looking good to me.
They look good? All right, we'll move your slides along. And Doug, you may want to do a quick intro to folks so they know who you are.
What happened? Can you hear me, Michelle? Give me a thumbs up. I'm sorry, Michelle, can you give me a thumbs up if you can hear?
Yes,
Okay.
Doug, we can hear you.
Couple points. This was not a major rousing victory for the Republicans. The entire country did not shift. It was a very narrow election. Trump did win, but only by 2.5 million votes. The Harris campaign, Harris and Walz, lost they received less than 11% fewer votes than Biden did in 2020. So it was a very tight race, and it really did come down to a very few states. This led overall for the Republicans to win the Senate. They have a 53-47 Senate advantage. In the House, they ended up gaining 2 seats. Democrats gained 2 seats in the House races. So actually they did pretty well there. The interesting thing is the Democrats won Senate seats in Wisconsin, Michigan, Arizona, and Nevada, but they lost the presidential, which means people switched. They voted for one candidate for president, and then they switched parties for the Senate race. So it's not as if this was this rousing defeat for the Democrats. One point that came up is that even in Pennsylvania, which was a very tight race, that came down to a recount. It was so close. So Democrats actually did pretty good. And hearing from a Democratic consultant, he was saying, overall, we made a point that if we were to win Wisconsin, Michigan, Arizona, and Nevada, we were going to say we had a really good night because they knew they were going to lose the Senate. Next slide, please. So with the 119th Congress, it's going to convene on January 3rd. The Republicans have only 219. They do not have 220 because Matt Gaetz' seat is now open. And there are several other seats. Zeldin for the EPA, there's a gentleman named Walz out of Florida that's going to join the national security. Stefanik is going to the UN. So if all those seats go, it's going to be about a 216, 217 to 215 situation in the House, which is going to mean that Speaker Johnson has no ability to maneuver. He's not going to be able to do very much because he doesn't have a strong majority. When Trump won in 2016, he had a 45-seat advantage in the House when he won. This time, he's going to have a less than a 5-seat advantage. Elections will occur for these seats, but that's not going to happen in New York until April. So for the first 100 days, it's going to be a very narrow advantage for the Republicans. That means things will happen, such as what we learned today. They had an agreement together on the debt ceiling. They needed to raise the debt ceiling to make sure that the country stays afloat and the government remains open over Christmas. That got scuttled at the last minute here because Trump was able to change a few votes, change the minds of a few of the Republican congressmen to say, no, we're not going to agree to this. And so therefore, Mike Johnson doesn't have the votes. If he wants to move forward, he's going to have to get either more Democratic votes or change the minds of these 2 or 3 Republicans to make sure the government stays open. Even if the government closed, no matter what, the 119th will reconvene on January 3rd. One of the first things they're going to have to do is deal with the debt ceiling. They're going to have to get that passed. Without that, the government will shut down. The Senate, on that side, the Senate has passed the debt ceiling. They've passed the budgets for everything, even though the House has not agreed to it. They've done their work. So when January 3rd turns around, the Republicans will be in charge. So they're going to have more authority and more ability to come up with budget figures, but they're not going to be able to do it unless they get all their people on board. The inauguration starting January 20th. We're dealing with 1,200 Senate confirmations, and that need to get through the Senate, and 26 members of the cabinet, which means 15 department heads, 10 cabinet level staff, and not the vice president, but those 2 will need to get through the Senate. So you'll need to have senators on your side and approving all these cabinet members. That's a less of a lift for the Republicans in the Senate side than what Speaker Johnson has to deal with. However, President Trump is not making it easy for them. He's appointing fairly controversial people. And that means that there's gonna be more challenges and more drama in the confirmations, which means things will get held up, and the Trump agenda is going to have more difficulty moving forward. The next slide. Okay, the Trump agenda. He's going to want to continue his policy. He has a big agenda on foreign policy. Border security is important. He needs to tackle inflation, and he wants to transform the civil service system. Let me get through this. Number one, the tax policy. That's one thing he probably will pass. He probably can get that taken care of. That's not terribly, I can't say controversial, but it's something that all the Republicans can get behind and support. But we don't know the details yet. We don't know who's going to benefit or not. We do know that if they don't do anything on the tax policy, that it's going to revert, at least for the not for the business taxes, corporate taxes, but for personal income taxes, will revert to what we had in 2016, which is something Trump definitely doesn't want to see happen. So there's a lot of ability to get the tax policy adopted. Foreign policy going to be much more difficult. He wants to put an end to the Ukraine war. The way he's thinking about doing it is accepting the border as it is as of today, and then giving lots of money to Ukraine to rebuild. The problem with that is he needs Ukraine to agree to it, and he also needs to get the EU to agree to it. He can hold back on ammunition, but that doesn't mean the EU can't keep it going. I think he's going to have a real difficult time with trying to get Ukraine and the EU to agree to what he's going to come up with. But that's very important on his agenda. Border security, that's something else. That's what he ran on. That's another thing that's going to be difficult because it's going to require congressional appropriations, congressional support. So that's going to be very difficult to get that through with such a narrow majority. Transformation of the civil service system. He's talked about that, talked about Elon Musk making changes. That's not going to happen. It will not happen. The unions aren't going to allow that to happen. And Elon Musk is not going to be able to move forward with what he wants to do, because if you take a look at what the way the federal government is set up, a majority of the budget goes towards Republican issues. And so it's going to be very difficult for any transformation of the civil service system to occur. Next slide, please. Here's the budget. This is what the fiscal budget for the fiscal year of 2023 was. They spent $6.1 trillion. Of that, part of 1.3 trillion, Social Security. 839, Medicare. 616, Medicaid. Income security, that means the treasury programs that can't really be touched. The interest on the debt can't be touched. So basically, and you got the defense, 917 billion. So basically all he has that's not a Republican priority that he can mess with is non-defense budget. Now, granted, there is $900 billion that he can mess with, but it's not enough to come anywhere close to the amount of money that they're talking about that they want to cut the budget. Big part of that discretionary non-defense money goes for agriculture. If you've noticed in the recent budget authorization and the debt ceiling, that included $10 billion for farmers. That didn't even get passed. So I don't think he's going to be able to do much with that non-defense amount, just because he wants money for farmers, he wants money for Social Security, he wants money for the defense for the wall. He wants money for immigration. He wants money to put Ukraine. He wants money to solve all his problems. And that's all coming from non-defense sector there. So it's going to be incredibly difficult, if not impossible, for the Trump administration to cut the budget. He's just not going to be able to do it. He's going to make a lot of noise. He's going to make a lot of, make a lot of comments, but he's not going to be able to cut the budget anywhere significantly. Next slide, please. The big 5 federal agencies. This is where your money goes. It goes to the net interest. It goes mandatory is 66%. Health and Human Services, Social Security. These are all things, like I said, these are big ticket Republican items. He is not going to be able to get the Republican Congress to agree to them, especially being so narrow. The only way he's going to be able to do it is to get some Democrats on his side. I don't think that's going to happen. Plus, he's got to expand the budget, the debt ceiling, so they can pay the debt they've already done. So it's going to be a very difficult year, but that doesn't mean he's going to be very effective. Next slide, please. In the states, when you start looking about what happened in the state legislatures electorally, nothing happened. It's status quo. Everything remains the same. We've got the same number of Republican legislatures as we did before. We're not seeing a big change one way or the other. One of the reasons I want to bring this up is that in the 118th Congress, Congress passed 82 bills. A majority of those were to rename post offices. Congress does not get a lot done. You turn to the states. In the 50 states, over 150,000 bills were introduced, 33,000 were enacted. So when it comes to the big ticket items for environmental health, food safety, mobile food trucks, food freedom, tattooing, body art, PFAS, chemical safety, nutrition, everything that we do is being done by the states. So that's where the activity is. State legislatures enact 10 times the number of bills that we see in Congress. Right now, majority are being controlled by Republicans. What you must remember, though, is no matter which party's in charge, if you have a problem, you have to deal with it. Mississippi has an obesity problem. That is where we're seeing the taxes on sugary drinks and obesity plans occurring. Texas has issues with farmers markets and food freedoms. That's where we're seeing changes and limitations on farmers markets to become regulated so they're not selling unsafe foods. So if it's a problem, the legislature has to deal with it. It does not matter which party is in charge. And we're going to see that quite a bit. We're going to see the most activity coming out of the states, and it's going to be coming out of both red and blue states. Next slide, please.
Doug, would you like to talk a little bit with Dr. D about our priorities? Because it looks like we have about 5 minutes left.
Can you get the next slide, please, Michelle?
There you go.
Fiscal year 26 will be a lean budget year. We're going to see the end of the federal COVID support. Medicaid is rising. It's the foremost cost for states. There's high enrollment, aging population, and whatever the Trump administration does, I doubt it will add more funding for Medicaid. Natural disasters continue to occur. In 1980, we had 3 natural disasters of over $1 billion. Last year, we had 30. This is going to mean more and more FEMA monies are going out the door, and it's going to be very difficult for the states to come up with those matches. Florida had to go into a special session to pay for Hurricane Helene that went through. This is getting to be a bigger problem, not less of a problem. But mind you, states are second responders. The federal government is a third responder. They want to make sure that they get this money to the states, but they can't do it unless the state asks for it, unless the state pays the match. Next slide. This is where I was going to have Dr. Dyjack speak, but it looks like he already went through. Final up, this is our priorities. The federal environmental health budget, meaning the CDC, National Center for Environmental Health, and the FDA Human Foods Program. Public health loan forgiveness funding is our priorities. We're going to support the environmental health workforce, and we're going to support state, local, tribal, and territorial environmental health agencies and that workforce. Final slide. I just want to tell everybody that we're going to keep active. We're going to go out of our way to make sure environmental health is known before the government officials. And we are going to remain active at NEHA to make sure your interests are presented before the federal government, for the states, and before every policymaker out there. With that, I'm going to have to turn it back over to Michelle. Michelle, please go for it.
Have a question that came into chat for you and or Dr. Dyjack. Does NEHA leadership have plans to visit CDC and FDA partners in 2025?
Michelle, we have visited with the FDA commissioner and the CDC director's office throughout my almost 10 years at NEHA, and I have every expectation that we will continue to prioritize CDC and FDA with personal visits once the new administration is in place. In addition, we don't limit ourselves to those two agencies, and we cultivate relationships in places like EPA, places like HRSA, the ASPR's office, and other federal agencies that have influence over our profession. So the short answer is yes, but we need January 20th to come and go for the confirmation process to come to a conclusion. And then we will do our best to personally have FaceTime with the new directors and commissioners, as the case may be.
And those of us all working in environmental health, we're all in this together. It's not just NEHA, it's NEHA in partnership with our workforce. What opportunities do you see for environmental health professionals to strengthen their advocacy efforts, both at the federal level and within their state and local areas?
I'm going to defer to Doug because he has a great new initiative underway. Doug?
My great new initiative is we've got a setup where we're going to make it very easy for affiliates, for individual members, for associated members to be able to write their congresspeople to say, this is what we'd like to do. This is what we want to do. We're going to make these letters going to be personalized, and they're not going to be a general letter coming from NEHA. It's going to be a personal letter coming from our members showing these congressmen that their constituents themselves are interested in these areas, not that this is something that that is only of interest to an association, that this is of interest to their individual members. We're also going to use this service to be able to write letters to the editor and build up the environmental health language, the environmental health advocacy out there, not only at the federal level, but at the state and local levels as well.
Thank you, Doug. And as we are all in this together, we look forward to seeing all of you as we do the Advocacy Insights every month. Keep an eye on the NEHA website, on your EH News in community. We'll provide you with further information for that. If you have further questions, you can drop it into community and we will get that over to Doug and to Dr. Dyjack. We want to thank you all for your time today. Thank you for all that you do in environmental health. And we wish you all joy and peace for the holidays and the new year. See you all soon.
Thank you.
Michelle, thank you very much. And thanks for everyone. Take care.
Bye-bye.